Kendra, and she's going to be talking about a strategy to integrate mental health counselors and therapists in CPS classrooms. So, Kendra, if you could also just, Lee said, like have your phone out and get that timer up whenever you are ready.
Right.
We'll go ahead and get started.
All right, I am ready to go. Good evening, CPS family. I will begin with narrating a short video that provides a visual depiction parallel to the current state of our schools. In November of 2022, New York hosted their annual marathon where runners were met with unprecedented weather conditions. Daniel Do Nascimento was overzealous about winning and did not heed to the safety recommendations or pay attention to the feedback from his body. Consequently, he collapsed during the race. Similarly, Cincinnati Public Schools has been presented with extreme conditions that can also send the district into a state of overwhelm as a result of experiencing a combination of too much too soon and too little over a long period of time. For example, the COVID-19 pandemic, learning loss, challenges with transportation, swatting incidents, and a host of other concerns that has drastically impacted the well-being of all the district's constituents. From my position as an educator, licensed counselor, and parent within the district, I recognize that we are in a state of emergency. The district has been persistent in their efforts to address mental health through contracted providers, mind peace rooms, employing additional therapists, and the implementation of a social emotional curriculum, which are all great endeavors. However, the problem is that many of the schools have not observed the full efficacy of these services due to several challenges such as difficulty with access, lack of communication about the resources, and the absence of a holistic approach. I propose establishing a comprehensive mental health network system. This will ensure that therapists are an integral component within the school environment. The therapists are employed with the district as members of the counseling department and the instructional leadership team. They will have the sole responsibilities of being an instructor, working directly with the respective teaching teams, administration, in addition to leading the partnership with the contracted mental health providers. In the capacity as an instructor, the therapist will utilize a social and emotional curriculum encouraging the body and mind connection. Furthermore, they will collaborate with teachers to engage in cross-curricular lessons that are embedded in reading, history, and other related topics. As a result, students will become knowledgeable about what is happening within their body, experience critical cognitive reflection, make connections, adopt practical steps to attend to their needs, and feel empowered to maintain wellness. While working on the team, the therapist serves as the liaison to offer perspective regarding student achievement and interventions for individualized plans. Lastly, the therapist will work in conjunction with the counseling department and partners to streamline resources, make referrals, facilitate training and school-wide events to advocate for wellness and engagement. Employing this system ensures a variety of benefits for all stakeholders. This endeavor directly aligns with the Superintendent's Be Present initiative and the district's guardrail to not ignore the needs and the talents of the whole child. Also, this will aid in the district's effort to yield a return on its investment as a result of utilizing an evidence-based approach to inform instruction and lessen continual outsourcing practices. Additional byproducts are a positive school culture, trust regarding mental health support, reduce teacher burnout, minimize over and underdiagnosing, which perpetuates the school to prison pipeline, and it will allow for individuals to operate within their scope of practice with authenticity and competency. Most importantly, I believe that this approach will champion students and staff to feel safe, secure, and valued, to yield expanded learning opportunities, increase academic outcomes, while making positive investments throughout our community. Throughout my experience, I have been afforded with the privilege to implement this design in several districts, and the feedback has been rewarding. One of my former students stated, "You have to see me in my good before you can tell me about my challenges." I trusted that I could be vulnerable with you because of your constant presence. You taught me the foundation of understanding and communicating my emotions to de-escalate situations. I knew that you were invested in me. It is my belief that we can finish our race like the winner, Evan Chebet. He conveyed the understanding that slowing down and being attuned to his body will help him be successful. I charge that we are able to be successful and win the marathon too.
Wow, Kendra, that is a way to close out the night. Thank you so much. All right, let's get our CPS panel pinned here. And let's see what their thoughts are.
So I think I'll jump in first. Well done on the presentation. Thank you so much. I actually have several questions. I remember that you asked this question or very similar question at the recent Be Present session last week or week before. So I think one of the questions that I have, knowing, and you referenced it in the beginning of your presentation, that the district has really done a lot in the area, in the space of mental health. And I don't think, looking at some of the comments, I'm not sure that there is clarity around that. So each of our schools has a school social worker that really does additional work with students in this SEL space, and that tier 2 support in terms of mental health support. Each of our schools has access to a mental health provider right now, and mental health therapists in the school building. You referenced MindPeace, which is one of the calming spaces that students are able to go into in terms of that. So knowing I think the one thing that's different about what you're recommending in this pitch, what we talked about at the Be Present session, is knowing that there is a critical shortage across the country for mental health therapists, or mental health professionals, period, just as there is for teachers. If you're looking at a proposal where mental health therapists are assigned to each classroom, I think that's what I heard, what would you propose doing in order to find enough therapists to then provide that level of intensive support throughout the school district?
So first of all, great question. So it wouldn't necessarily be where you have a therapist for each classroom. It would more so be along grade bands, because we do know that there is a critical shortage. So say, for instance, in a particular school, you may have, in an elementary setting, it may be 1st through 3rd grade could be a grade band, and then 4th through 6th grade. So you're able to make sure that, they are in a position of serving as an instructor, but they're not, you're not trying to pull from a shortage of therapists or a population of individuals that's not there. So it really would be trying to make sure we are accessing those that we already have. So you talked about employing several therapists already within the district. So it may be repurposed in terms of how they are utilizing their services. And then also, I think the recruitment measure is important. So making sure that we're connecting with higher education, making sure that there's a lucrative process, because you do have a lot of therapists that have left the profession due to burnout, right? Or due to having to do notes, or just the intense need that's required. But there are a lot of therapists that would love to be in a position of an educator, and you all as a district have amazing benefits, and so that could be a selling point to help recruit and retain those therapists as well.
Okay, one more question for you. Great. Thank you for sharing that. I think the second is, coming from an initiative where I had to hire therapists in schools specifically. And knowing that right now, if we have the challenges where we are not able to get the therapists in individual one-to-one school environments, to duplicate that so that you have multiple therapists in one school, I think exacerbates another issue. One of the things that has come up in terms of digging into this question with our team and getting feedback from schools is the whole thought process around whether or not students have access to insurance or Medicaid, so that therapists can then use that in terms of billing. So what suggestions would you have around that particular piece of it, in terms of being able to then, provide additional resources in terms of funding and availability. I think we're all seeing the increased need for mental health support services. And I think that's one of the reasons that we also don't have the number of mental health supports that we're looking for. And when we talk about people of color, we have even fewer. And so I applaud you for being a champion for this. But what would you think about in terms of additional funding mechanisms outside of thinking about, being able to bill an insurance or bill Medicaid?
Mm-hmm. So in terms of, I'll address the insurance piece, and that's why I'm actually proposing that, because I do know that there is a significant challenge for students to actually get the service that's needed. And so those agencies or those contracted providers will actually serve in the position of those students that may need more intense care or intense service, while the actual therapist that's employed by the district is helping to offset more of those immediate needs and able to apply those social and emotional skills that are maybe at a more basic level. And so they're able to learn these skills and these mindsets and behaviors. So in terms of additional funding sources, I think it's just one of those things where you have to just analyze what you want to invest in, right? What is most important and what's most significant to you as a district for you to identify, is this something that we spend money on, and maybe possibly doing like a pilot based off of the data that you all have collected to see, okay, will this work based off the needs that certain schools have, for you to make the decision of this is something that you should propose district-wide.
Great presentation. Very, very, very timely. Thank you so much for sharing it and for the depth of the information that you provided. Thank you so much.
You're welcome. Thank you.